Alright team, let's start the diagnosis. The patient presents with myositis, gingivitis, and sesamoiditis. Thoughts?
My initial diagnosis would be systemic lupus erythematosus. It fits the symptoms.
I'm leaning towards Sjogren's syndrome, considering the gingivitis and myositis.
I would also suggest rheumatoid arthritis as a possibility.
I think it could be mixed connective tissue disease. The symptoms match up.
Enough. You're all wrong. It's chest photofluorography. No question about it.
But Dr. Hawks, that doesn't match the symptoms at all.
I said enough. We're going with my diagnosis. Perform a VATS lobectomy on the patient immediately.
But that procedure is risky. Are you sure it's necessary?
I don't care if it's risky. It's the only option in my medical opinion. Now hurry up. We don't have time to waste.
I don't know about this, Hawks. This doesn't seem right.
I don't give a damn what you think. You will follow my orders or you'll be out of this damn hospital. Now move! God damn it. Tracy, you called me in here because you're questioning my decision to perform a VATS lobectomy on my patient with chest photofluorography?
Yes, Hawks. I have concerns about your diagnosis and treatment plan. You've had a track record of being wrong in the past.
Oh, come on, Tracy. You can't keep bringing up the past. I have years of experience, and this time I'm sure I'm right about the VATS lobectomy.
I understand that you're confident, but we can't afford to make any mistakes. We need to consider all options and make the best decision for the patient.
Trust me, Tracy. I know what I'm doing. Let's not dwell on the past. This time I have a gut feeling that this is the right course of action.
I respect your expertise, Hawks, but please understand that I have to be cautious. Let's discuss this further and come to a consensus before making any final decisions.
Oh no, the patient is in critical condition. We need to act fast.
I can't believe Hawks insisted on the VATS lobectomy for chest photofluorography. It was clearly not the right treatment.
No kidding. This isn't good at all. We need to figure out what the correct treatment should be. This is a delicate situation.
I think we can still turn things around. It might not be as serious as it seems.
Sweet love of Jesus. What were you thinking? Chest photofluorography misdiagnosis. VATS lobectomy. You almost killed the patient?
I'm sorry, Dr. Hawks. We thought we had the right diagnosis.
Yeah, we were following the symptoms we observed. What do you think the actual diagnosis is then?
Please enlighten us on what we missed. We want to learn and improve.
Yeah, come on, Doc. Tell us what we should have done instead.
You all are a bunch of incompetent fools. I can't believe I have to work with such a clueless team. The patient does not have lung cancer. It's a pulmonary infection. How could you miss something so obvious?
Maybe because you told us it was a photo of someone's chest, we thought you were onto something?
Or onto someone given how detailed that photo was?
What do you idiots think photofluorography is?
It has the word photo in it, so probably involves using a camera of sorts.
It's an X-ray of someone's chest. It showed pulmonary infection despite Hawks calling it lung cancer earlier.
Alright, at least we know Randall isn't as brain dead as the rest of you. I'm off to lunch. Don't page me, or I will lose my shit even further. Hey Johnson, how are things in the oncology department today?
Things are going well. We're seeing some progress with our patients, and I'm hopeful for their recovery. How about you? Any interesting cases lately?
Actually, yes. 3 out of my 4 doctors had no idea what photofluorography was. I assume you have lots of experience in that.
What a lucky guess. What do you think is wrong with your patient?
I believe it's a rare autoimmune condition causing the symptoms. It all makes sense now.
Wow, that's amazing. Well, I'm glad you solved it. I guess I'll see you around.
Thanks, Johnson. I need to go check on my patient now. Goodbye. Sorry for breaking in, but we might be looking at this all wrong.
Hawks, you can't just waltz in here without proper gear.
Yeah, you're putting patients at risk.
I get it, but trust me on this one. Chest photofluorography missed something crucial.
What are you talking about, Hawks?
Musicogenic epilepsy. I discussed it with Dr. Johnson over lunch.
Musicogenic epilepsy in the lungs?
Is it treatable? What's the prognosis for such a condition?
Patients respond well to anti-epileptic drugs. Prognosis is usually optimistic.
Well, I guess we should look into it then.
Thanks, Tracy. I appreciate the congratulations.
You did a great job finding the right diagnosis for the patient.
Yeah, Well, it shouldn't have been a big deal if I didn't have such incompetent doctors around me.
Hold on, Hawks. You were the one who initially misdiagnosed the patient.
I know, but my team should have caught that mistake before it escalated.
You can't just shift the blame onto your team, Hawks. You need to take responsibility for your own errors.
Abruptly stands up. I need some air. We'll talk later.